What is folate? Folate, also known as vitamin B9, is a water-soluble B vitamin. It naturally found in vegetables such as spinach, broccoli, and other leafy green vegetables. Folate supports essential processes such as DNA synthesis and red blood cell formation. The synthetic form folic acid is used in supplements and fortified food. This process is critical for DNA replication, especially in rapidly dividing cells. Without folate, DNA synthesis stalls, leading to impaired cell division and megaloblastic anemia.
Now, I will explain how folate is digested and absorbed in the body. Folate exists in different forms depending on where it comes from. Folic acid, which is found in supplements and fortified foods, is already in a form called monoglutamate. Because of this, it does not need digestion before absorption. However, folate that naturally comes from food is present in polyglutamate form. This form cannot be absorbed directly and must first be digested. Digestion of dietary folate happens in the proximal small intestine, mainly in the duodenum and jejunum. Here, an enzyme called folate hydrolase, or also known as glutamate carboxypeptidase, removes the extra glutamate groups one by one. Once converted, folate is absorbed into the intestinal cells through a carrier protein called the proton-coupled folate transporter, or PCFT. PCFT works best in a slightly acidic environment. After absorption, folate leaves the intestinal cell through a transporter called MRP3. It then enters the portal circulation, allowing folate to travel to the liver and other tissues in the body. After folate enters the cell, it is still in an inactive form. Inside the cell, folate is converted into its active form called tetrahydrofolate, or THF. This conversion is carried out by the enzyme known as dihydrofolate reductase. Once activated, THF plays a critical role in DNA synthesis and normal cell growth.
Folate-dependent pyrimidine synthesis involves the coordinated roles of several organs, particularly the intestine, liver, and bone marrow. Dietary folate, also known as vitamin B9, is first absorbed in the proximal small intestine. Through specific transporters, folate enters the enterocytes, where it is converted into reduced folate forms. These reduced folates are then transported via the portal circulation to the liver. The liver acts as the central organ for folate processing and regulation. Here, absorbed folate is converted into tetrahydrofolate and further metabolized into 5-methyl tetrahydrofolate, which serves as the main storage and circulating form of folate in the body. The liver then releases 5-methyl tetrahydrofolate into the bloodstream to supply peripheral tissues according to their metabolic demand. One of the most folate-dependent tissues is the bone marrow, where rapid cell division occurs during hematopoiesis. Circulating 5-methyl tetrahydrofolate enters bone marrow cells and is converted back into tetrahydrofolate and subsequently into 5,10-methylene tetrahydrofolate. This active folate derivative donates 1 carbon units required for the conversion of DUMP to DTMP, a key step in pyrimidine synthesis. Therefore, efficient folate absorption, hepatic processing, and bone marrow utilization are essential for DNA replication, normal blood cell maturation, and overall genomic stability.
So, these are a few of the clinical relevance of folate in pyrimidine synthesis, which include neurotube effects, megaloblastic macrocytic anemia, and cancer. First, in neurotube defects, folate is required for thymoidylate synthesis, which is essential for DNA replication during early embryonic development. Folate deficiency impairs DNA synthesis that can lead to failure of neurotube closure. This is why folate supplementation before and during early pregnancy is a key public health strategy. Then, megaloblastic macrocytic anemia occurs when folate deficiency disrupts DNA synthesis in the bone marrow cells, causing cell cycle arrest in the S phase of cell division. This causes delayed nuclear maturation and the formation of large, immature red blood cells, known as megaloblasts. Diagnosis involves low serum folate levels, and treatment includes folic acid supplementation. Lastly, in cancer, folate deficiency can disrupt the cell cycle by causing inadequate thymidylate production. This results in uracil misincorporation and hypomethylation of chromatin. Therefore, your folate deficiency will cause DNA instability and abnormal cell growth, increasing risk of cancer such as colorectal cancer and lung cancer. However, this is useful in some chemotherapy drugs, like methotrexate, which target folate metabolism to stop the cancer cell division. In summary, folate is essential for pyrimidine synthesis and DNA replication. Folate deficiency can disrupt the normal cell division and contributes to several clinical conditions. In pregnant women, adequate folate intake is especially critical to support the rapid fetal cell division and prevent neurotube defects. Therefore, adequate folate intake is essential for both disease prevention and maintaining overall health.